This is a dissection exposing the right side of the mid-thoracic region, from superior to inferior, again left side and right side, medial to lateral. What we're seeing superficially are the first layer of dorsal muscles that are associated with the spine. We see the supraspinous ligament, and in a deeper layer we see the interspinous ligament. We can identify the spinous processes that have a vertical projection and the laminae of this right side with a very, very small space between the laminae. We also see the transverse process, and if we remember, the transverse process has a facet for the articulation with the body of a rib, and this facet in between we're going to find costotransverse ligament. After removing the lamina, we can expose the dura mater, and we also expose the dural sleeve of the intercostal nerve root. We see that the nerve root has a dorsal and ventral rami, and that the dorsal rami is going to travel over the superior edge of the rib. Anteriorly, we see the costal demifacet, and we also see the interbody space with the intervertebral disc. We can identify the bodies, and anterior to that, we can also identify the pleura. This is a posterior view from superior to inferior, medial to lateral. We can visualize the superficial trapezius muscle that is attaching to the upper thoracic and cervical spinous processes, as well as the latissimus dorsi muscle that attaches to the mid and lower thoracic spinous processes. After removing the superficial muscles, we can expose the lamina, visualize as well the transverse process and its articulation with the body of the rib, the dorsal rami running over the superior edge of the rib, and in between these ribs we can observe the intercostal muscles that are muscles that help for the respiratory function. We can again identify the costotransverse ligament. It's a ligament that lies just at the joint between the anterior portion of the transverse process and the posterior portion of the body of the rib. A close-up view, superior, inferior, medial to lateral, from deep to superficial, the pleura, the intercostal artery. The intercostal arteries are branches that originate from the thoracic aorta from the 3rd to 11th segments. The thoracic aorta lies at the mid left parasagittal portion of the vertebral body, meaning that the right intercostal artery has a longer course compared to the one in the left side. We can also see that the intercostal artery travels along with the intercostal nerves that, as we mentioned before, are going to be traveling over the superior edge of the rib. We see the transverse process, the inferior articular process, superior adjacent articular process, the zygapophyseal joint, lamina, the intervertebral foramen being exposed, the vertebral bodies and interbody space with the disc, and of course the spinous processes with their respective ligaments.